Hello, my name is Gobinder Singh. I'm an orthopedic surgeon and I've been practicing in orthopedics. My interest has been in this field for about 6 or 7 years now, and I've been looking at various options in biological techniques. The best biological technique we have currently is stem cell therapy, and we'll talk about that in a brief moment. First of all, just to show you that at the end of a joint, this is a knee joint, we flip the patella over, you see that the end of the bone has this white, shiny cartilage. And this is slippery, strong, and it should hopefully last our whole lives. But we know, unfortunately, that's not the case. Sometimes through damage, through genetics, or through trauma, through accidents, you can have an area which is worn out, either in a small area or in a larger area. If it's very severe, it is actually arthritis. Osteoarthritis is what we're talking about. In small damages, we want to do something to patch this up, or in not so severe disease. Now, orthopedic surgeons use a grade called the Kelgel-Lawrence grade on x-rays to define how bad your knee is. If you're a grade 4, you're so bad you need a joint replacement. If you're grade 0, grade 1, you've got a very good knee and don't need to worry about it. The problem is, what do I do with people who have grade 2 and grade 3 changes? How can we help them to get back a better function? Surgery is not the answer, as I've already said. So what's the next step? Stem cells are what helps us to regenerate in general. Cartilage is an area which is very difficult to regenerate. The body doesn't heal up cartilage on its own very easily. Cartilage problems, what happens is that we use a pure growth of mesenchymal stem cells, meaning these are cells that are not from your own body, but cells that we harvest. This is done as a clinic outpatient procedure with local anesthetic after cleaning the skin, first with a surgical prep, then a little bit of local anesthetic into the skin, then an injection goes into the joint. Now, what these mesenchymal cells do in the joint is that they do two things. Number one, they sit in the area where there's a cartilage defect and actually change from mesenchymal stem cells to cartilage cells, and they help to patch up that area. The second thing that it does is the cells themselves stimulate your body's own cartilage cells to start to grow. So it's really fascinating, and I'm sure, in my own opinion, I'm sure that this is the future of minor and moderate joint injury. For this particular therapy, I work with Cell Malaysia, and I'm on their panel of doctors.